Xcopri Tablet is used to treat a certain type of seizure disorder, partial onset. It is not known exactly how it works, but it may affect the action of some nerves that cause seizures. Xcopri may be used alone or with other medications. Xcopri belongs to a class of drugs called anticonvulsants. How to use? Xcopri can be prescribed as monotherapy or injective therapy. If needed based on clinical response and tolerability, dosage may be increased above 200 mg per day by increments of 50 mg per day every 2 weeks to a maximum of 400 mg per day. For patients with mild or moderate hepatic impairment, the maximum recommended dosage is 200 mg once daily. Xcopri is not recommended for use in patients with severe hepatic impairment. Xcopri may be taken anytime with or without food. Swallow the tablet swallow with liquid, do not crush or chew. In an open-label study when Xcopri was titrated at 2-week intervals, there were no reported cases of drug reaction with eosinophilia and systemic symptoms. This finding does not establish that the risk of DRESS is prevented by slow titration. However, Xcopri should be initiated at 12.5 mg once daily and titrated every 2 weeks. Contraindications: are allergic to Cenobamate or any of the other ingredients in Xcopri, have a genetic problem that affects the electrical system of the heart. Precautions: it is very important that your doctor check your progress at regular visits. This is necessary to allow dose adjustment and to check for serious unwanted effects. Serious skin reactions, including drug reaction with eosinophilia and systemic symptoms, may occur during treatment with Cenobamate. Tell a doctor right away if you have a fever, skin rash or blisters, or swollen, painful, or tender lymph glands and neck, armpit or groin while using this medicine. Contact your doctor right away if you have any change to your heart rhythm. You might feel dizzy or faint, or you might have a fast or uneven heartbeat that lasts a long time. This may be symptoms of a heart rhythm problem called quad shortening. If you develop any unusual or strange thoughts and behavior while taking this medicine, be sure to discuss it with your doctor. Other changes might be confusion, worsening of depression, suicidal thoughts, and unusual excitement, nervousness, or irritability. What are the side effects of Xcopri? Get emergency medical help if you have sign of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat, fast or pounding heartbeats, fluttering in your chest and sudden dizziness, like you might pass out, feeling very weak or tight, severe muscle pain, fever, swollen glands or throat, unusual breathing or bleeding, painful sores in your mouth or around your eyes, swelling in your face, mouth, or throat, trouble breathing or swallowing, hives or a rash, yellowing of the skin or eyes, any infection or illness that does not get better, or nervous system problems, dizziness, trouble walking, loss of coordination, vision problems, drowsiness, tiredness, problems with thinking or memory.